What's going on with Minnesota's Medicaid program? A mix of fraud investigations, funding freezes, and growing conflict between the state and the federal government have been all over my newsfeed lately. This might sound like just a bureaucratic dispute, but the effects are very real for the people who rely on this program, and that's the topic of this week's Healthcare Triage. Medicaid is a major source of health coverage for low-income Americans, including children, seniors, and people with disabilities. In Minnesota, it supports more than 1 million residents. Disruption to funding or services is a big deal. So what's happening right now that has Minnesota Medicaid in the spotlight? For some time, investigators have been concerned about unusually large-scale fraud in certain Minnesota Medicaid-funded programs. Several programs have been implicated, including those providing services like autism therapy and housing support. In some cases, individuals and organizations have been charged with billing for services that were never provided or for exaggerating the care they delivered. The fraud itself isn't being disputed. Both state and federal sources have acknowledged that it's happened and it needs to be addressed. There is, however, disagreement about how widespread the problem is. Some federal offices have suggested the losses are extremely high, while state officials have pushed back, saying there isn't adequate evidence for those estimates. The tension has escalated, and earlier this year the federal government moved to withhold hundreds of millions of dollars in Medicaid funding from Minnesota. Officials said the decision was tied to concerns about fraud and whether the state had done enough to prevent it. The funding at issue was tied to specific programs that had been flagged as high risk. Minnesota responded by suing the federal government, arguing that the funding was being held back unfairly and citing concerns about harm to residents who depend on Medicaid for care. The state also emphasized that Medicaid is a shared program, meaning both state and federal governments are responsible for overseeing it. As this played out, uncertainties started to ripple outward. Healthcare providers reported confusion about whether they would continue to be paid, with some warning that prolonged disruption could force them to cut services or scale back operations. Medicaid often covers long-term treatments, therapies, and support services that people rely on to maintain their health or independence. When funding is uncertain, so is access to that care. Despite the lawsuit, Minnesota was not ignoring the fraud allegations. The state paused and even shut down some of the programs identified as high risk for fraud and launched audits to better understand where the problems were. They also increased oversight, including reviewing providers more closely and implementing new anti-fraud measures. Fortunately, these efforts have been fruitful. In March of 2026, federal officials approved an updated anti-fraud plan from the state, which allowed roughly $243 million in previously withheld Medicaid funding to be released. That's good news for patients, but the situation has sparked a broader debate about what's really driving these actions. Some argue that fraud concerns are being used as a justification for stricter federal control or broad reductions in Medicaid funding. Others argue that stronger oversight is necessary to protect taxpayer dollars and to ensure that the program works as intended. The problem is that real people are getting lost in the middle of that debate. If funding is delayed or reduced, it doesn't just affect government budgets. It affects whether clinics stay open, whether providers can continue offering services, and whether patients can access care without disruption. For now, Minnesota appears to have avoided the most immediate financial hit, thanks to the approval of its anti-fraud plan. But the underlying tensions haven't gone away. The bigger question is what happens next. Not just in Minnesota, but across the country. The combination of increased fraud investigations and tighter federal oversight could lead to similar conflicts in other states, especially where large public programs are under scrutiny. This tension is largely political, with partisan messaging controlling the narrative. That's unfortunate, because for people who rely on Medicaid for their health care, this isn't about policy debates or funding mechanisms. It's about whether medical care that they need will still be there when they need it. And isn't that the whole purpose of a healthcare system? Hey, did you enjoy this video? You might enjoy this previous video on Medicaid work requirements in the real world. We'd really appreciate it if you'd like the video and subscribe to the channel down below. Consider going to patreon.com/healthcaretriage, where you can help support the show, make it bigger and better. We'd especially like to thank our research associates, Joshua Crow, Edward Liljeholm, and Christopher Learn, and of course, our Surgeon Admiral, Sam.